Hi, welcome everybody. Welcome to Southwest Florida and Caring Medical. What would we call it? Caring Medical Studio. The Caring Medical Studio. So we've listened to you. You've said to us that obviously in previous webinars, and I would really encourage anybody to watch our other webinars. We have 12 hours of webinars on the vagus nerve, on upper cervical instability that have been done already, and those are available at Caring Medical's YouTube station. And you've said to us, it'd be better if I was, more mobile and I could explain things a little bit better and have the screen bigger. So we definitely have tried to do that today. And I'd really encourage your input into whether the current format you feel like the webinar, it explained things a little bit better. You'll also notice in regard to the illustrations, we've tried to do less words. And you know me, I love to have arrows and going everywhere. So just know this is it's a simpler version of what's going on in the body. But today I want to cover the understanding and resolving the symptomatology of hypermobility, Ehlers-Danlos Syndrome. This was a logo that we made almost 30 years ago, Power Over Pain. And as you all know that Ehlers-Danlos Syndrome, it basically causes systemic pain. It can cause systemic pain. And my bias, if you will, is that the pain is stemming from joint instability. So we are going to talk a lot about joint instability and how joint instability screws up the neurology. And I guess today I got a clicker, so I'm going to click my first click. Ooh, I did it right. This is at the Caring Medical Florida office. That obviously I love yellow because yellow is a happy color, and that's really what this webinar is about. It's about giving hope that there actually is something that people can do who have dizziness, vertigo, mast cell activation syndrome, chronic pain, chronic headaches, brain fog, and they also have Ehlers-Danlos Syndrome, hypermobility type. Now I should say, as we'll get into, that when somebody has joint instability from any of the Ehlers-Danlos conditions, that prolotherapy is effective. For those who want to follow us, those who are Hauserians, so thank you for all the Hauserians out there. For those who want to subscribe, we would really appreciate you going to Caring Medical and subscribing to our newsletter. We have a great newsletter. I want to thank my media team specifically. Thank you so much for Barry, who puts together the newsletter, and he's been an unbelievable publicist for all these years. For Izzy, who's doing the webinar today, she's in charge of that, our Instagram. Nicole Baird in Oregon, a longtime friend, has worked for Caring Medical for years. She did an amazing job putting together this webinar. For Ben, you're outstanding, so thank you so much. Ben works with the media team. He does a lot of the editing. Ben currently is helping edit the 2,000-page joint instability book that I just finished. So actually, this is going to be my last webinar for a while because Ben and I and the media team have to get that joint instability book. What? Yeah, I know. Okay, and then so what we are going to do, though, if you have any questions or you would like topics discussed, I'm going to do shorter segments, like 5-minute segments that can easily be seen on cell phones. Obviously, our graphic designer, full-time graphic designer, is Travis Mitchell. Travis, you're outstanding. Thank you for everything that you do. And obviously, the whole Caring Medical team, I think, does a great job. So we have lots of videos on brain obstruction, on obstruction of cerebral spinal fluid, on basically the topics that we're going to discuss. Okay, I guess I'm the one that's got to do it. These are some of the things that we do at Caring Medical Florida. The team, some of the members of the team are Brad. There's me as we do transcranial Doppler on a patient. This is a patient with Brad measuring the optic nerve sheath. That's one of the ways that we tell if somebody has increased intracranial pressure, intracranial hypertension that we'll talk about. Danielle Stylen, she's the other prolotherapist at Caring Medical Florida. Brian Hutchinson, Dr. Hutchinson is an amazing chiropractor who does some innovative things, which we call dynamic orthoneurologic correction, where he uses X-ray guidance to guide the positioning of the vertebrae. So we have the ability to align the vertebrae and then basically glue them back together or have them stay together with prolotherapy. Joe, one of our nurses, Kathy, this is Kathy doing autonomic nervous system testing, which we'll talk about. And the testing protocols that we do at Caring Medical often involve motion. And anybody who has pain or who has headache or who has vertigo or has brain fog, basically they'll tell you or they'll tell me that it actually gets worse when they're upright typically, and then it's better when they're laying down. So the testing protocols that need to be done to show joint instability should be done with motion and upright. And as you guys know, a lot of the tests you get for, chronic neck pain, headaches, it's with you lying down. And that's why the MRIs, the MRAs, the CTAs, the MR venography, all these things don't show the abnormality because you have to do it with you upright and moving. Today, we're going to talk about EDS, the most serious of systemic joint instability syndromes. So I look at Ehlers-Danlos Syndrome as a systemic joint instability syndrome. And I think that's a good way to describe hypermobility EDS, that it's a systemic problem. It involves joint instability all over the body, and it causes a myriad of symptoms which we would describe as a syndrome. So today we're going to talk about living with EDS, an overview of ligamentology. Ligamentology is the study of ligaments, and my specialty as a ligamentologist or a specialist in ligaments and how to regenerate and repair ligaments. EDS, ligament-induced pain, EDS-induced fatigue, like what actually causes all the fatigue of Ehlers-Danlos syndrome. EDS, toxic brain. As you know, at Caring Medical Florida, myself specifically, I see some of the worst cases around the country. Like patients will come in already with central lines. They can't control their blood pressure unless they have salt infusions. Some of the patients come in with 80-pound weight loss. We recently had a person who lost 80 pounds because they had gastroparesis and their stomach wasn't working. So just know we're equipped to handle some of the worst cases in the country as EDS causes some of the most serious of the systemic joint instability problems. We're going to talk about EDS, cervical destruction, and cervical vagopathy, how the destruction of the cervical spine supporting structures then eventually leads to neurologic injury, specifically the vagus nerve. We're going to talk of a real common symptom, syndrome, dysautonomia in POTS, the nauseous feeling of EDS. There's a lot of people who have Ehlers-Danlos syndrome and they just continually feel nausea, and I'm going to explain what causes that. And throughout it, I'll just sprinkle some stuff about prolotherapy. But for anybody who wants more information about prolotherapy or actually to see prolotherapy procedures like in the neck, please go to our video library at caringmedical.com. Ehlers-Danlos syndrome, hypermobility type, or just Ehlers-Danlos syndrome in general, is a chronic progressive destructive ligament disability. Chronic progressive destructive ligament disability. So what does that mean? We all know that Ehlers-Danlos syndrome is a genetic condition that is inherited, so it's chronic if people have it from birth. It's progressive. Joint instability is a progressive disorder. Like, for instance, on a door hinge, if one screw is loose and you keep opening and closing the door, the next screw gets loose, Once that hinge is loose, the next hinge gets loose, right? So imagine, here, I'll just take my neck model. So here's a neck model, and if the C1, C2 gets loose, and the body can't compensate by stabilizing it with muscle spasm, and you keep using your cell phone, well, the next hinge, the C2, C3, C3, C4, C4, C5. So often when we scan people, they have just multiple joint instabilities in the neck, in the lower back, in the peripheral body. So that's one of the reasons why when they get surgery, like they get stabilization of, say, C1, C2, which sometimes is needed, you know, the neurosurgeons, sometimes it's needed, but what happens is then the joints above it or below it get loose, and that's why the symptoms often can recur. Now, it's a destructive ligament disability. It's destructive. Once you get joint instability in any joint, and realize Ehlers-Danlos Syndrome is a systemic joint instability condition. Once you get joint instability in, say, the shoulder, then when the person moves the shoulder, they get destructive joint forces on the shoulder, which causes further ligament injury, labral injury, articular cartilage, joint cell death, and then you get basically massive degeneration of the joint. And the word degeneration means cell death. So when you have ligamentosis or ligament degeneration, it means that there's not the normal amount of fibroblasts in that tissue, so thus it can't make the ligaments. So thus you need more ligament cells or fibroblastic cells, and the word prolotherapy stands for fibroblastic proliferation. So that's kind of the science behind it. And obviously, if you have multiple joint instabilities, it can be really disabling, really disabling. And the team at Caring Medical Florida, we take it really seriously. And some of the patients who have, you know, whole body joint instabilities, you really need a team to take care of the person. So one of our mottos is hope is practice here. Hope always means that there's hope in the future that your life's going to get better. And today, one of the patients in the office, I was saying, this was the reason that God probably didn't have us see the future was that hope keeps you going. And I can tell you definitively that there is hope if you have Ehlers-Danlos Syndrome and you're really struggling with joint dislocations, dizziness, vertigo, your stomach's not working, your intestines, you have Meniere's disease diagnosis, autoimmune disease. I'm telling you definitively that there is hope, and that hope is in treatments that stabilize the joint. And the treatment that works the best for most cases is prolotherapy. Prolotherapy by tightening the ligaments, stabilizing the joint. Then the neurology then follows that. The neurology starts getting back to normal. And here are some of the smiling faces of some of the patients that I've treated. Crystal Lowell, she's the world champion in double mini trampoline, so hey to Crystal. And her videos are on the internet. Michael, we see guys, not just gals with Ehlers-Danlos, we see guys. Michael, over the course of the last, probably 15 years, I've put many of his joints back together. Stephanie, we talked about at the last webinar. Angela, many of you guys probably know, you follow her and you're following her journey. She is an extremely special person. Rebecca, you're going to see later. And then Karina, and then Louise. So Louise is another special lady. Louise is about ready to be launched into China. She actually is fluent in Mandarin. So many of these people, you'll see that they're very young, but some of them, Rebecca started seeing me at the age of 13. Louise her family flew in from an island off of England, and she basically had a normal childhood basically because of prolotherapy. And then she like all these people, what I've noticed, this is just my opinion in regard to people who have Ehlers-Danlos Syndrome, they're unbelievably intelligent. Like, that's what drew me right away. Like, super, super smart. Super, super smart. Like, really smart. And so if you're gonna help anybody, surely these would be some of the people that you would want to help. Crystal came in 3rd in the world last year, and they told her that she was done. This was in 2015. That she had a bad ankle injury. She got prolotherapy. That got her back to being one of the best gymnasts in the world. And all of these people are getting their lives back because of prolotherapy. Now, just to show you some of the crazy things I see at Caring Medical. So this was a case that we saw in the last couple months. You can see that the person, they have Ehlers-Danlos Syndrome and their intestines are in their lung cavity. I kid you not, their intestines are in their lung cavity. When I was listening to the lungs, you could actually see the bowels gurgling. And this is interesting. So the normal treatment for this, she didn't have a diaphragm tear. It's just, she has basically paralysis of her phrenic nerve, right? The phrenic nerve, it comes from C3, C4, C5. That's one of the reasons why people have shortness of breath or respiratory problems when they have Ehlers-Danlos Syndrome or cervical instability. And the normal operation is to plicate or staple down the diaphragm in the right position. And you know what the surgeon said? And more surgeons are saying this. They said to her, you have first got to get your neck stabilized. You have to get prolotherapy. So so obviously the tide's turning as it relates to the acceptance in the medical community for prolotherapy. And then this is what comes into Caring Medical often with Ehlers-Danlos Syndrome. This is just literally the history on one patient. This is just one patient. So a lot of patients with Ehlers-Danlos Syndrome have been diagnosed with celiac, folate mutation, folic acid mutation, and all these issues. And if you look at all these issues, you can see that many of these have at their core joint instability, right? The chronic fatigue can be from joint instability. Thoracic outlet syndrome is joint instability in the shoulder, in the neck. Muscle pains, joint instability. Hip instability. Hypertension, we're going to talk a little bit when we talk about POTS, but when you got cervical instability and your vagus nerve is not inhibiting the sympathetic nervous system, the sympathetic nervous system goes crazy and it can clamp down on blood vessels. It can clamp down on blood vessels, and that can be the cause of structural hypertension. Memory loss, obviously, if the blood flow to the brain gets cut off, right? We all know that the vertebral artery, right? The vertebral artery is in the neck, the vertebral artery. Then the carotid artery is in the front of the neck. And what about the person who says, no, I had an MR angiogram or a CT angiogram? Yeah, you did have it, but you had it with it laying down. Like you had it with laying down and you're not moving your neck. Well, we do transcranial Doppler and extracranial Doppler. So we measure the blood flow in your brain when you're moving. And guess what happens when you're moving? The blood supply tanks because of the neck instability. So once you resolve the neck instability and you correct the curve, then the blood supply gets back to normal. And obviously memory can improve. Eyesight deterioration. What's going to happen if you have obstruction of cerebral spinal fluid flow because of instability at C0, C1, C1, C2? Then you get swelling of the optic nerve. The optic nerve is the eye nerve. We can measure if the optic nerve is swollen by ultrasound. So all the weird darkness in the eyes, all the unusual focusing problems, blurry vision, flashing lights, almost all of that is because of unresolved cervical instability, and it's a progressive disorder, right? It's a progressive disorder. So somebody who starts having eyesight problems with Ehlers-Danlos Syndrome, it isn't like all of a sudden it gets better. It normally progressive. Arthritis is from joint instability. Stomach pain is because the vagus nerve input into the stomach isn't right. We'll talk about that. Allergies, food allergies. When you get vagus nerve issues, the tight junctions in the digestive tract separate, you get leaky gut. Anybody who's had leaky gut, chronic Lyme, mold toxicity, chemical sensitivity, and it's not working, the treatment regime isn't working, it's probably because your vagus nerve function is bad. And we'll talk about how to measure the vagus nerve function. You need to get a digital motion x-ray to look at whether or not you have cervical instability affecting your vagus nerve. Mast cell disease, the same. POTS we'll talk about. Constipation, the bowels don't contract normally unless they have normal vagus nerve input. When you have vagus nerve input to the bowels, guess what? They have motility. So if you don't have motility in your stomach, your small intestine, your large intestine, you have vagus nerve injury, you have vagus nerve degeneration until proven otherwise. If you have small intestinal bowel or bacterial overgrowth, small intestine bacterial overgrowth, meaning why are there so many bacteria in your small intestine when the bacteria are supposed to be in your large intestine? Well, probably the valves between the small intestine and large intestine aren't working, or the small intestine, the stuff's just sitting there. You know, like in other words, the small intestines aren't working. Why aren't they working? Because of the vagus nerve. Acid reflux, same thing, vagus nerve. Hiccups, vagus nerve. Bloating gas, vagus nerve. So really this patient, instead of having 22 different diagnoses, they probably have one major diagnosis, which is systemic joint instability syndrome, and the main instability that's affecting them is the neck. So this is, you know, we're a level 2 surgery center, meaning we can do conscious sedation in the office. So that's our nurse anesthetist, Troy, getting out bone marrow from a patient, and then we're going to inject the bone marrow all over this patient's body and all the various joints to regenerate the joints. Now this is Dr. Hemmel, so I'm going to talk a little bit about the history of prolotherapy. We're not going to spend a lot of time with this because it is about Ehlers-Danlos Syndrome. So this is Dr. Hackett. Dr. Hackett is the person who coined the word prolotherapy. That's Dr. Hackett with his young protege, Dr. Hemmel, and I'm the young protege, if you will, of Dr. Hemmel. I joined Dr. Hemmel when I was 30, and I joined his practice on January 6, 1993. So I've been doing or performing prolotherapy for almost 30 years. That's the young Dr. Hauser. I joined Dr. Hemmel when he was 85. So we call our type of prolotherapy H3 prolotherapy, Hackett, Hemmel, Hauser. So it probably was very important for Dr. Hemmel to have somebody with the last name starting with H. So it's comprehensive treatment, meaning that when the front ligaments get stretched out and a person may just have front shoulder pain, we actually do the whole mesh of ligaments around the joint. So that's the primary stabilizers of the joint are the ligaments. Normally treatments are every 4 to 6 weeks, except if somebody has an unbelievably severe case, then I might see them every 2 weeks. But the normal person who has knee instability, they would be seen every 4 to 6 weeks for about a total of 4 visits on average. We can do multiple body parts. There's lots of different proliferants. Often people are asking us, well, are you going to inject PRP, stem cells, fat, bone marrow? And I always tell them the most important decision in regard to whether prolotherapy is going to work or not isn't the solution, it's the prolotherapist, right? So the more severe a person's condition, right? If somebody with Ehlers-Danlos Syndrome, like recently I did a consult, well, I just called out of respect a chiropractor whose daughter's not doing well. She has Ehlers-Danlos Syndrome. Her health is tanking. She may not be able to get back to school. And I was just trying to explain to him, this is a really serious condition. When you get cervical instability and your stomach's not working and your daughter's losing like 3 or 4 pounds a week and she can't afford to lose anymore, this is a life-threatening condition. It's a life-threatening condition. This isn't something like you get a few shots in your neck and some miraculous thing's going to happen. I mean, this is a really serious condition. Like there's a lot that goes into it. So you need a whole team. And I think what's missing in a lot of the clients, the more severe clients with Ehlers-Danlos Syndrome, hypermobility type, is they don't have a captain of the ship. So I just want to kind of explain my background, because a lot of people don't know my background. So I'm actually going to put the clicker away. And years ago, about 30 years ago, Marion and I wrote Prolo Your Pain Away. So this is actually Prolo Your Pain Away in Korean. So the book Prolo Your Pain Away, it has been translated into different languages. So just know on our website you can get a free download of Prolo Your Pain Away. And I think that's a really good place to start in regard to anybody who really wants to understand prolotherapy. And prolotherapy is an injection technique that stimulates the repair of painful areas. Specifically, it causes the growth, the tightening, the strengthening, the thickening of ligaments. And we'll see data that people with Ehlers-Danlos Syndrome just have very thin ligaments. They have very thin ligaments. So they need beefing up of their ligaments. So that's a key point. Write that down, beefing up of your ligaments. If you get beefing up of your ligaments, trust me, the shoulder pain goes away, the knee pain's going to go away, the ability to walk's going to get better. And if you get beefy, tight ligaments in your neck, it's unbelievable what happens. The memory comes back, the dizziness goes away, the swallowing gets better, the singing ability improves, eyesight gets back to normal, and obviously life can be, joyful again. So lots of different books. Prolo Your Arthritis Pain Away. Marion and I, we started the Journal of Prolotherapy. So anybody can type in Journal of Prolotherapy. You want to see some of the things that Dr. Hauser wrote. Many of these things I wrote 20 years ago, 15 years ago, and some of it's even good. So this is the book that Marion wrote. I was co-author, and Nicole, the Hauser Diet. So basically, when somebody's losing weight or somebody feels excessively hot or excessively cold, and maybe their vagus nerve input to their stomach isn't so good, then we do got to get involved in the diet. So because here, I'm going to show you this. Here, this is in 2001, Alternative Medicine Digest called Caring Medical, the Ideal Clinic. This is in 2001. They called Caring Medical the Ideal Clinic. There's Marion and I when we were younger, about 20 years ago. So coming to the clinic wasn't just people with Ehlers-Danlos Syndrome, chronic pain. It was even people with cancer. So a lot of people don't realize, Marion and I, we wrote a book called Treating Cancer with Insulin Potentiation Therapy. The very first patient ever treated in the United States with insulin potentiation therapy was at Caring Medical, and we're grateful to Dr. Donato Perez Garcia for teaching us, as well as Dr. Ayer for teaching us insulin potentiation therapy. And this is one of the things I'm most proud of, because insulin potentiation therapy is a great treatment for cancer, and it's now done around the globe. So we were part of the team that did that. So obviously we had to get involved in diet. So we came up with a protocol of how to tell whether somebody should be on a lion, a carnivorous diet, otter, bear, monkey, or giraffe diet. So we can easily tell somebody that. So you can see where if somebody has a central line, their blood pressure is off, they have mast cell activation syndrome, they're losing weight, the person's stressed out, the mother and the father are stressed out. Obviously, because of all the medical care that often didn't work, the finances are an issue. So there's a lot going on. So you could see where you need a team and you need a doctor who knows how to handle all these complicated things. So at the Hauser Neck Center, Caring Medical Florida, we have patient coordinators, we have nurses. Many of my staff have been with me 20 years. So we have a very, very good team to care for the complexities that occur with Ehlers-Danlos Syndrome. Just to give you a little tidbit, today in our office, we did a transcranial Doppler exam, like measuring the blood flow in a 5-year-old. So you know as well as I do, because Ehlers-Danlos Syndrome is a genetic condition that it is from birth, and because of these pads, kids are supposed to be looking up. They're supposed to be looking up to get their cervical curve, but now the kids have these pads, so they're getting neck instability. They're getting neck instability at a very early age. So if it was a child of mine and they had seizures, or they weren't developing good, or they got, the diagnosis of autism, or nobody could explain why their behavior is terrible, or all of a sudden the way they walked was off, I would look into whether or not they have neck instability and whether the blood supply to the brain is okay, or the vagus nerve. Because it may be a structural thing, right? It may be a structural thing. Too often medicine's like, no, it's a psychological thing, or it's this or that. And even people who go to well-meaning alternative medicine doctors, and obviously for years I'm an alternative medicine doctor, if you will. I'm not, in other words, I do things differently. I don't use anti-inflammatories for pain. Like, no pain is an anti-inflammatory deficiency. No pain is a steroid deficiency. If you have autoimmune disease, there's a cause for the autoimmune disease. There's a cause. What caused the breakdown of the digestive tract? Well, and I've said this many times, you have to follow the neurology. And if you follow the neurology and the neurology leads you to the neck, then look for neck instability. You probably have a structural leaky gut causing an autoimmune disease. And the treatment then is you gotta resolve your joint instability, and most joint instabilities, including cervical instability, can be resolved with prolotherapy. I just want to acknowledge many, many great organizations around the globe. Hypermobility Syndrome Association, the Ehlers-Danlos Society, obviously here in America. They do a great job, so thank you. They've been very supportive of prolotherapy, so thank you. The EDS Awareness Society do a great job, and over the years I've gotten to meet and talk to and love some amazing people that are in the Ehlers-Danlos organizations and are doing everything they can to help. And one of the people that is very special to me is Karina Sturm, so I want to show her film here. Oh, I'm sorry. I clicked wrong. Oh, it's here. Okay. Sorry, you should never give me a clicker. This is the one. So Izzy's going to prop up the Karina's film.
He would always,
Beware.
He always
Why?
still does. Every time I walk by in the hallway, he'll say she's faking it. I don't even know why he does that.
People have boxes in their heads that either a wheelchair is a permanent thing or you should be able to walk. And it's humiliation to stand there in public and someone's going, oh, so you can walk, can you? Why are you in a wheelchair then?
Also jeder neue Arzt, den du musst, ist Stress, für mich purer Stress. Wenn der das erste Mal mich komisch anschaut, dann habe ich Panik. Dann sehe ich Herzklopfen, Schweißausbrüche, dann will ich gehen.
It's kind of like shouting in the sky. It rains.
You just want one person to back you, one person to believe you, and you not have to go through the pain of vindicating yourself again and again and again.
They love spending time with their friends, they love playing with their friends, but they get tired so very quickly. So every morning it's yelling, why do I have to go to school? We get tired at school, we get pain at school, nobody understands.
I only have one friend. I have nobody else besides her because nobody else accepts me like I am.
Izzy gave me my clicker back. Please support Karina. I really encourage everybody to watch the whole documentary film that she did. She did a great job, and she's definitely one of the people that's fighting for Ehlers-Danlos Syndrome. So Karina, great job. We love you. And anyone who's has Ehlers-Danlos Syndrome and they've had it for a long time, they at some point are going to get some kind of dysautonomia. They're probably going to get where they get diagnosed with low hormones, various kind of joint instabilities, headache, digestive issues, which we're going to talk about today, and fatigue. So the question is, does the person with Ehlers-Danlos Syndrome have all these different diagnoses and they have different causes, or might there be just one cause? And I'm just saying the cause is systemic joint instability. It's joint instabilities. And if you resolve the joint instability that's causing the immune dysregulation, it goes away. So if a person with Ehlers-Danlos Syndrome been diagnosed with, you got babesiosis, you got Lyme's, you got, this infection, that infection, is it really you have all those infections, or might you just have immune system deficiency because of cervical vagopathy? You have chronic fatigue syndrome. You have, migraine headaches. You have occipital neuralgia. Really, that's what you have? Don't you really have like C1, C2 instability hitting the C2 nerve, which gives occipital neuralgia? It's a joint instability problem. It's a joint instability problem. And if you resolve the joint instability, guess what? The headache goes away. This is, I would say, one of the more important figures that we made for this talk. Like, somebody has nausea, they get an endoscopy, it doesn't show anything, so then the gastrointestinal doctor says, you don't got any problem. Are you kidding me? You got a major problem. Your stomach's not working. Like, you got gastroparesis because of vagus nerve problems, so maybe you need a motion heart rate variability parameter test. So I'm going to show you, I'll show you one. I'll just delete the patient's name. I'll delete the patient's name. So if you see this, and it's multiple pages, but you'll notice here, see how it says dystonia? So in other words, it says dystonia, like in other words, with certain movements, this particular patient with certain head movements, they all of a sudden started getting dystonia. But you'll notice the heart rate variability and the parameters, the vagus nerve function didn't change that much. So what does that mean? It means that even though we did the head motion and it caused a dystonia right in front of us, so we film it, so right in front of us, the vagus nerve function didn't change, so thus the vagus nerve is not the cause of this person's dystonia. So what we did was then we did a transcranial Doppler, a motion transcranial Doppler, and guess what? The blood supply, because of her instability in the upper part, the blood supply to a certain part of her brain stopped for 5 seconds, 8 seconds, and all of a sudden they got the dystonia. So in the office, we try as much as we can to give objective evidence of what's causing the problem before we start prolotherapy. So that way, because you know as well as I do, if you know actually what the cause of the symptom is, the actual cause of the symptom, and you treat the cause, the success rate is very, very high, very, very high. Swallowing difficulty, right? You get an endoscopy or you get a barium swallow, it's negative. What you need to do is get motion heart rate variability testing. So in other words, we hook you up with different electrodes, and then we see, is the vagus nerve function affected by your head motions, because the vagus nerve innervates the larynx, the pharynx, and it's involved in the contractility, and it's also the nerve supply to the vocal cords. So in other words, the nerve supply to the vocal cords is the vagus nerve, and as you'll see later, the brains of the vagus nerve sits right in front of C1, and if the brains of the vagus nerve is getting shellacked because of cervical instability, you're going to eventually get swallowing difficulties. You'll get your voice might change. That's why we do a lot of stuff with voice. Blurry vision, you get an ophthalmologic exam and they say fine, but what you need is you need an ultrasound of the optic nerve sheath diameter, and it might show that it's swollen, so you actually have increased intracranial pressure, and we can monitor that as we go along with prolotherapy and make sure that the swelling of the optic nerve sheath is going down. Dystonia, the person gets a brain MRI, it's fine, or they get a brain, or they get a MR angiogram of their neck or their brain. It doesn't show anything. They do a motion transcranial Doppler, and that shows the constriction of the arteries to the brain. So the real cause of the problem is cerebral hypoxia. The cerebral hypoxia resolves once the instability in the upper neck or somewhere in the neck resolves. Dizziness, same kind of thing. Static MRI angiogram shows nothing. You got to get a transcranial Doppler. Same thing. Headaches, similar. Trigeminal neuralgia, right? People get neck, brainstem MRIs. What they really need is a digital motion X-ray to show the instability affecting the vagus nerve. A lot of people don't realize a lot of the function of the vagus nerve is inhibitory, meaning that the vagus nerve has connections to the facial nerve, to the trigeminal nerve. So if you get rid of the inhibitory effects of the vagus nerve on the trigeminal nerve, you get what? Trigeminal neuralgia, or you get other cranial nerve neuralgia. So if you've been diagnosed with any cranial nerve neuralgia and they can't seem to figure out the cause, it's probably because the vagus nerve can't inhibit or help regulate the normal firing of those nerves. And even as we relates to POTS and the sympathetic system, and I think of, believe it or not, the sympathetic system as the death system and the vagus nerve or the parasympathetic system as the life system. So think about it. If you're under stress, you're under stress, you're under stress. Are you going to be having life or are you going to be having death? Is your physiology going to be good or is your physiology going to be bad? So in other words, when the vagus nerve is not inhibiting the sympathetic system or the death system, guess what happens in the body? You get toxic physiology or death physiology. You know, you get autonomic storms. That's what a lot of my patients call autonomic storms, like something bad's going to happen. You know, the heart starts racing and you know something bad's going to happen. And almost every one of those cases, it's because of the vagus nerve, the life system. The life nerve is not functioning good. So if you have a vagus nerve problem, please have your lifestyle be calming and joyful, which starts with get off of the internet. Why are you watching this? Why are you watching this? You're not supposed to be on the... No, but you know what I mean. If you guys would be shocked, I just don't research certain things on the internet, like all the stuff that's going on in the world. Like you and I are in the life-giving business, like we're in the help business, we're into like let's make the world a better place. So for us to do that, we have to have our lives be peaceful, safe, calm, and that's going to help our vagus nerves. The stronger our vagus nerves are, the stronger our immune system, and of course if we get exposed to something, then we're going to be able to fight it and beat it. And then brain fog, and we're going to talk a lot about that today. Like brain fog is a big issue. This is a great study that they did on EDS in kids, little kids, and what they found was that the two main things that affected quality of life in the kids was fatigue and pain. Fatigue and pain. I feel tired and I got a lot of pain. So this webinar we're going to talk a lot about that, like how to resolve the pain of Ehlers-Danlos Syndrome and how to get rid of the fatigue. So these are some of the horrific secondary damaging effects of chronic pain. Like it isn't just the pain, it has so many awful effects, right? Like in other words, many people with Ehlers-Danlos Syndrome have been told that they're hypochondriac or depressed and that's the cause. It isn't the cause. It's structural pain causing structural sadness. Or how would you feel if like your whole body hurt every day? Like of course you would be depressed. Friends stop seeing you. That's what in Karina's video, like they stop seeing you, right? Because you don't feel good. you're unable to go to school or hold down a job. Then, of course, you get financial stress from that. You cause stress and financial burden for your family, and you feel guilty. So we absolutely talk about that in the office. And I'm one of those doctors that if a patient wants me to pray with them, we pray. They want to read the Bible together, we read the Bible together. Because that's what caring is about. It's about, first and foremost, that it's one human being trying to help another human being. And I hope that the clients know that I love them, and I'm grateful for all the prayers and all the hugs and all the joy that the patients bestow on me. And of course, my team, it's the same way. Like, it is caring medical. Obviously, when you have chronic pain, life becomes a painful endurance, energy levels plummet, can't do the normal activities. And this is actually a big one. You live in a state of fear for many reasons: pain recurrence, hospitalizations. And you saw even the one case I said, I think she had already 18 surgeries, and that doesn't even include all the hospitalizations. And remember, I said almost all of her symptoms could be attributed to the vagus nerve. Like, in other words, if a person keeps doing what they're doing, and they're going to get the same result. So I'm saying, please, please, if you're struggling really badly with vertigo or dizziness or terrible fatigue or pain all over your body, or you've been diagnosed with small fiber neuropathy or fibromyalgia or the other 100 different things that people with Ehlers-Danlos syndrome get diagnosed with, please consider that it's actually the cause of all these symptoms and all these other diagnoses is actually joint instability. Joint instability in the neck, joint instability in the shoulder, joint instability in the thoracic area. Anytime a joint clicks, pops, grinds, it's not normal to move your neck and get clicking, popping, grinding. If you have that, you have joint instability, and the treatment starts with prolotherapy. Obviously, I believe people should get a digital motion x-ray, and we'll show one of those, but please go to our site to see various kinds of digital motion x-rays and different results, and it's me explaining how to interpret a digital motion x-ray. Obviously, at some point when you're disabled enough, the resiliency of the human spirit starts to go. And obviously, many people have what I would call about faith. What's it called? Like a crisis of faith. They have a crisis of faith. Like, does God even exist, or does God even care? And I can just tell you, because I see the before and afters, he absolutely cares, and he absolutely wants you to get better, and you can get better. So now what I do, this is how our practice runs, is I do telemedicine, or before somebody comes in as a patient, I have my team evaluate the case. So please, if you are considering coming to Caring Medical, go to our website, caringmedical.com, fill out everything, fill out a form, and then one of my staff would review the case, and if needed, I actually do a Skype visit, or a, what's it called? Video consult. Yeah, video consult. I'm electronically inept, if you will. So, like, you never want to have me have a clicker. Like, this is just a disaster. Like, what happens if this falls and it goes, like, does that mean it's over? But no, so we do, what did you call it? Telemedicine. So so I do consults. So often, because I've done them all the way from the Sea of Omen, wherever Omen is. So this guy, joint hypermobility syndrome, I don't know if he had Ehlers-Danlos or not, but he's sitting by the Sea of Omen in the Middle East, and I always try to end it with, and I'll just call his name Saeed. So it's like, Saeed, I'm just telling you, you're on the right road. You have some instability, you have upper cervical instability, and there absolutely is a treatment for it. So for right now, please, wear a collar when it's hurting a lot. And then I told them some different positions and different things to do. And that's, again, giving hope, because once you know what the problem is, and hopefully with all the webinars that I've done, that you'll realize that these are structural things. The anxiety is from a structural problem. It's, cervical instability, the depression, the gastroparesis, the liver not working, the gallbladder disease, the autoimmune disease, the inner ear problem. It's all from joint instabilities, and you have to get the joint instability resolved. And we know there's various criterion to diagnose hypermobility, Ehlers-Danlos Syndrome, so we do that in the office. So we do all this in the office. We even do the aortic root and the mitral valve prolapse. So is this going to be a video? No. Okay. Okay, so Tom, I just want to see how Tom's kind of buffed, and we don't show his face too much because this guy is one handsome looking guy. But you could just see the muscle on Tom. So even though he has in crazy amounts of joint instability, and watch with his skin, how hyperextensible his skin is. His skin's really hyperextensible all over. I think he's going to do his neck here. And he has multiple joints that dislocate. You could just see very stretchability. He has hyperextension of his fingers, just normally. And you could see the papules, see those foot papules. Yeah, lots, and then they go away. So he met, and his mother was a longtime patient of mine. He's actually an orthopedic surgeon, so he's in the process of learning prolotherapy for animals. About 30 years ago, the very first conference on prolotherapy in animals was done in Chicago, and I was one of the instructors. So now if your animal, right, you have your dog has degenerative hip disease, they can go to a local vet who does prolotherapy and get their pain resolved. And they say that placebos don't work in animals. So if you want proof that prolotherapy works, the animal can't do anything, can't jump up, can't do anything. One or two visits of prolotherapy with an animal, and then the animal can then jump up again. And this is just what an ultrasound looks like for the aortic root when you're outside of the standard deviation here. Then you have aortic root dilation, and we know that vascular EDS and some of the other ones, you have to get a formal echocardiogram, but one of the diagnostic criterions for hypermobility EDS is aortic root dilation. So the cause of much of the symptoms of hypermobility EDS and the other types of EDS, it starts with ligaments or ligament laxity. So to actually learn to understand, you have to understand ligamentology. Ligamentology is the study of ligaments. A ligamentologist is an expert in the understanding of ligament health and disease. So Dr. Hauser is a ligamentologist. To resolve the majority of the disabling symptoms of Ehlers-Danlos Syndrome, you need to consult a ligamentologist. To understand EDS, you have to understand ligamentology. So I'm going to just talk a little bit about ligamentology. There's many things that cause stability in the joint, but the primary stabilizer of the joint are the ligaments. So, like this is obviously a pelvic floor model, and you could see the ligaments here, the SI ligaments. And if you look at the SI joint, the ligaments are in the front, in the back, on the side. And this is basically, so in other words, a person could have any nerve root injury here, and then all the neurologists, the anesthesiologists, everybody's looking at the nerves here, like the pudendal nerve or whatever, and what they're forgetting is all these nerves run within 2 or 3 millimeters of the bone. So the cause of the nerve getting touched, getting damaged, getting stretched is joint instability. And this occurs all the time. Almost all joint instabilities are from incompetent collagen that make ligaments dysfunctional. Fibroblasts make the collagen that makes up the ligaments. And this slide is very, very important. These are what the fibroblasts look like. So this is what the fibroblasts look like. Then the fibroblasts make up the collagen. The collagen is what gives the ligaments strength. There's type 1 collagen that makes up bones, ligaments, tendons. Type 3 makes up skin, blood vessels, intestines. Type 5 collagen makes up muscles, intestines, placenta, and other tissues. When you have a genetic disorder of type 1 collagen, that disease is called osteogenesis imperfecta. It's not Ehlers-Danlos syndrome. When you have a type 3 genetic collagen mutation, that causes vascular Ehlers-Danlos syndrome. Type 5 collagen mutation, genetic mutation, causes classical EDS. So in other words, as far as we know, with hypermobility Ehlers-Danlos syndrome, genetically, the collagen that makes up the ligaments, that gives the ligaments strength, genetically, the type 1 collagen genetically is normal. Now it's thin and it's stretched out, so it's not functioning good, but genetically it's okay. So what does that mean? Well, what it means is that an Ehlers-Danlos patient with joint instability is going to respond very well, just like other patients who have joint instability. So a person with Ehlers-Danlos syndrome who just has knee instability, right? In other words, they don't have symptoms in the other joints. The other joints are hypermobile, but they're not unstable. Like, they're not unstable. There's a little bit of laxity, but they're not unstable. And by unstable means that there's excessive motion in the joint causing symptoms. So they're going to respond just like another patient who has the same exact joint instability. They'll need 3 to 6 visits of prolotherapy. When somebody has Ehlers-Danlos syndrome and they have multiple joint instabilities, well, obviously hip joint instability is going to affect knee joint instability, which is going to affect ankle joint instability. So the number of treatments may go up if they have multiple joint instabilities. Type 1 collagen makes up approximately 90% of ligaments. This is a polarized light microscopy of a medial collateral ligament in a rabbit, and you could see type 1 is 90% of the collagen, and this is the type 3 collagen. So in other words, what gives the ligament strength is a type 1 collagen, and the type 1 collagen, the genetics of Ehlers-Danlos syndrome hypermobility type does not affect the genetics of type 1 collagen. So that's why prolotherapy works so good in Ehlers-Danlos syndrome. And you could say, well, no, what about if I have classical EDS or I have vascular EDS? No, it's the same. The type 1 collagen, even if you have type 3 collagen issue genetically, the thing that gives the strength to the ligament is type 1 collagen. So your genetics are fine, and those ligaments are going to get beefy. If you get prolotherapy, they'll get beefy. Then they're going to get tight. They're going to get strong. And then, like Crystal Lowell, right? She has significant amount of Ehlers-Danlos syndrome. When she trains, she has to run 20 yards very, very fast and then do various flips and go real high in the air, then land on her ankle that was treated 5 or 6 years ago. So prolotherapy can tighten and stabilize the joints of Ehlers-Danlos syndrome. This slide is actually very, very important. So in other words, the difference in an anterior cruciate ligament from being completely normal to tearing is only 2 millimeters. So think about that. The width of a quarter is only 1 millimeter. So 2 quarters is 2 millimeters. So when we talk about a ligament being incompetent and going from a stable joint to a completely unstable joint where the ligament tears, could only be 2 or 3 millimeters. So with prolotherapy, to get somebody from where the ligament is torn to the ligament stable, you just have to tighten it off in 1, 2, 3 millimeters. So that's what we're talking about. Tightening a ligament 1, 2, or 3 millimeters. So the anterior cruciate ligament is about 40 millimeters, right? It's 40 millimeters. So 2 millimeters extra for an ACL, it's not a big percentage of the ligament, right? Okay, so this is, people with Beighton scores. So we know that a Beighton score of 9, that's the maximum. the higher the Beighton score, in other words, the more amount of joint instability or joint laxity that a person has, the thinner the hip capsule. So look at that. When you have a Beighton score of 1 or 2, the hip capsule, the thickness of the ligaments, the hip capsule and the ligaments might be 15 millimeters, but when you have a high Beighton score, it's only 5. So that would mean that a person with Ehlers-Danlos Syndrome, the thickness of the hip capsule, the ligaments, capsular ligaments, it might be 1/3. That's how thin it is, 1/3. So if you have hip problems, you've been told you have a labral tear, don't get surgery, meniscal tear, don't get surgery to remove the painful labrum, because you need your labrum also to stabilize the hip. You need to get your hip capsule ligaments thicker, and you need to get the labrum repaired. So labrum responds really good to platelet-rich plasma. So in our office, we would do platelet-rich plasma into the hip labrum. We do that under ultrasound guidance. And then we do strong proliferants into the hip capsules. And over time, they get thicker, stronger. And then once they're thicker, stronger, the person can go run, they can go bike, they can go swim. Right? So look at that. So that's what we're talking about. The hip ligaments, it surrounds the whole joint. So I look at ligaments, even though on anatomy books they show all these really discrete little things. If you ever look at a cadaver, and I'd really encourage you to do that on the internet, these are meshes. It's just a big mesh. It's a big, big mesh, and it needs to be tightened. And the way you tighten it is with prolotherapy. Prolotherapy injections. So just the hip right here, if you did the front, the side, and the back, that might be 14, 15 shots. Ligaments are the primary stabilizers. Ligaments hold adjacent bones together. Ligaments go from one bone to another bone. The best analogy is they're the screws on a hinge. They're the screws on a hinge. And my voice going low, maybe if I could get some coffee. If I can get some coffee. So, no, my voice starting to change. That's, again, vagus function, you know. So, in other words, as my vagus nerve gets tired, then my voice will change. Almost all of the... Oh, okay, thank you. Oh, okay, thank you. Thank you. Most of the nerve endings, this is an important point. The cartilage doesn't have any nerve endings. So if somebody has pain in the knee, somebody with Ehlers-Danlos Syndrome has pain in the knee, most of the nerve endings are in the ligaments. So imagine a person has Ehlers-Danlos Syndrome and they can pop out 6 different joints, and the nerve endings are in the ligaments. The nerve endings in the ligaments are not supposed to stretch. So when a ligament's tight and the person does a lot of activities, the nerve endings in the ligaments don't stretch. So when you have ligament laxity, you have Ehlers-Danlos Syndrome, all these nerves are getting stretched. So they're getting stretched all over your body. So then the person has unbelievable pain. So the pain from Ehlers-Danlos Syndrome is because of the excessive stretch in the ligaments. That's a really important point. Once the ligament gets tightened, those nerves within the ligaments don't stretch. And when they don't stretch, they don't fire. And these are all the various kinds of nerve endings in the ligaments. The ligament is the sensory organ of the joint. So what tells my brain, hey, my hand's above my head, what tells it are the proprioceptor nerve endings in the ligaments. So that's an important point. So imagine like your body's trying to balance your head on your neck, and it has all these mechanisms for figuring out where your head is in 3D space. And many of the receptors that tell the brain that are in the ligaments in your neck, and all the ligaments are stretched out. So all of a sudden, like you feel dizzy, you feel lightheaded, so just ligament laxity in itself can cause all kinds of problems in the joint. Like it can cause, where even when you're walking, the way a person walks, it doesn't walk normally because the ligaments aren't tight, and when the ligaments aren't tight, the body can't sense normally how my knee's supposed to work in 3D space, and then the ligaments determine the muscle tension at rest. This is another important point. There's a ligament muscular reflex, so it means that if you have an anterior cruciate ligament injury in your knee, so that means your tibia is going to go forward when you're walking because that ligament isn't tight, then because of the excessive stress of the nerves within the ligament, it causes the muscles around the knee to tighten. So if you have Ehlers-Danlos Syndrome and you've had an iliotibial tendinitis forever and nobody can resolve it, bud, chick, the cause of it is the iliotibial band is tightening your lateral knee because your lateral knee is unstable, because you have laxity in your lateral collateral ligament. You got chronic hamstring tendinitis, it's probably because, or tendinopathy or tendon tear for no apparent reason. It's because the hamstring is trying to tighten because you have knee instability. So anybody with a chronic pain that's gotten a diagnosis of a tendon, a chronic tendinopathy, rotator cuff tendon problem, I'm telling you, it's not just a tendon problem. So don't go to a doctor who's going to inject your tendon without injecting the ligaments. The cause of the tendon problem is ligament laxity or joint instability. You have to get the whole joint stable, and that's going to resolve the tendon injury. You may have to get your tendon injected too, but of course you just do that at the time when you're getting the prolotherapy on your joint. So ligament muscular reflex. So please know what a ligament muscular reflex is. So if you have a muscle, like your neck's always tense, right? Nobody can get rid of the tension in your neck. It's not a muscle problem. It's not a muscle problem. It's an underlying joint instability issue. So here, I'll go back to here. I'll try not to screw up the clicker. Okay, so you have instability in the ligaments in your neck. So you're going to use your cell phone, right? You're using your cell phone, right? So in other words, the spinal cord and all this runs within 2 to 3 millimeters of the bone. So if your muscles didn't tighten in the back of your neck, and you have joint instability in your neck, that means every time you bend down, the bones would move and hit your spinal cord, right? And it would also hit the vagus nerve, which sits right in front of C1. So the ligament muscular reflex is designed to protect the joint and also protect all the neurology around it. So is it right to take muscle relaxants or to get Botox injections into your neck? If you have Ehlers-Danlos Syndrome, do you think it's a good idea that you take away the body's protective mechanism in your neck with botulism toxin? Do you think that's a good idea? I personally wouldn't do that. I wouldn't do that. Because the muscles got to be tense for a reason. Why are the muscles tense? Well, it's protecting your spinal cord and your various nerves, including your vagus nerve. Pain severity in various types of EDS. So look at this. Classical type, 76%. Hypermobility type, 98%. Kyphoscoliosis, 50%. Vascular, 55%. How many had dislocations? Hypermobility type, 85. Total, 71. So even with the other types of EDS, the majority of the people have significant amount of pain, significant amount of joint instabilities. Now, why not get surgery for the joint instabilities of EDS? Well, there's lots of reasons. One is we all know that surgeries notoriously fail when a person has Ehlers-Danlos Syndrome. And this is no disrespect to the neurosurgeons who do a great job with EDS, C1, C2. There's many, many good surgeons out there, but in general, surgeries don't do well in patients with Ehlers-Danlos Syndrome. These are some of the reasons that I don't think the surgeries do well, because the ligaments loosen after surgery. Then joint instabilities are significant in surrounding and contralateral joints. So in other words, somebody's going to get a C4, C5, C6 fusion. Okay, they have Ehlers-Danlos Syndrome. I'm not saying that C4, C5, C6 isn't unstable, but the person will get this surgery without getting a digital motion x-ray. So you got to first find out how is C3, C4, C2, C3, C1, C2. So if you get a fusion and they stabilize that and you have instability in those other areas, what do you think is going to happen right after the surgery, within 6 months of the surgery? So I have a pretty significant patient population of people that I see after fusion surgeries. And you know, I've said many, many times, when a doctor has recommended surgery, run, don't walk to a prolotherapist, because you have to get a second opinion, right? Because nobody would sign up for a fusion surgery if it's going to work for 2 years and get rid of some symptoms, but then for another 40 years of your life, you feel terrible. So I wouldn't do that. I mean, first go to a prolotherapist. So based on our motion testing that we do in the office, we can tell who's going to respond to prolotherapy and who's not. And I'd be the first person, if I believe a person needs surgery, I would send them for neurosurgery. You know, I'd send them to a doctor that has a lot of experience with Ehlers-Danlos Syndrome. But I'm telling you, prolotherapy can resolve most of the cases. And I should clarify, I don't get everybody better, but most of the people, the vast majority get better. You know, the vast, vast majority. I always say God's 10 out of 10, we're 9 out of 10. You know, we're 9 out of 10. Only God's 10 out of 10. Any doctor who says they get everybody better, that's not correct. Now, another reason why the joint surgeries in EDS fail is because pain and or neurologic problems not solely related to the lesion on MRI. And the classic thing, of course, is somebody has a bad herniated disc and the person gets surgery for the disc, then of course, it doesn't work. Why doesn't it work? Well, the disc herniates through ligaments. So the cause of the disc herniation or the degenerated disc is joint instability. So you got to get the ligaments treated. When they do arthroscopy or they do various surgeries, what do you think to get to the joint, like to do an arthroscopy, they stretch out all the ligaments. So if you've had a surgery and you have a lot of symptoms after that surgery, well, it probably is you still have stretched out ligaments. So why don't we just talk about like burning mouth and other weird neurologic things that occur after dental surgery. If you've had any kind of dental work and you just have all kinds of weird things that happened after that, it may be that the dental, like the wisdom teeth being pulled or whatever dental procedure you had, it may be that the surgery was fine, but the weird position. So if you have C1, C2 instability, C2, C3 instability, and you didn't know it, and you go get your hair done, right? You could get your hair done, you know, where they wash your hair like that, or the dentist, you know, you're like this for an hour. You know, no, so that can induce, that could be the straw that broke the camel's back. So in those particular situations where you just had your neck hyperextended, and always remember, you could have abdominal surgery, and then during the surgery, they have to put you out, and then they hyperextend you, right? And then you have, all of a sudden, you've got vertigo, dizziness, migraine headache, swallowing difficulties, gastroparesis after the surgeries. Probably what it is the surgery was fine, but the positioning of your neck during the surgery caused you to have upper cervical instability. So what you need is a digital motion x-ray. So please get a digital motion x-ray. Now, how I do digital motion x-ray, as you guys know, is I numb the neck. And the reason I numb the neck prior to the digital motion x-ray is because your muscles are designed through the ligament muscular reflex to prevent the motion. So if I do a motion scan on somebody, I want to make sure it's a ligament test. So the way that it's a ligament test is I numb the muscles. Then, of course, the person can get a little bit lightheaded, but that's okay because then they actually see how would they feel without the muscles. And they're like, I don't like this feeling. Yeah, you don't like that feeling because you got really severe neck instability. And so we document the neck instability. And then once you actually have a etiology, like, oh my gosh, that is so freeing. Because now you know, like the blurriness of vision is real, it's from your neck. The swallowing difficulties, the migraine headaches, the tension, it's all from the joint instability. And you know the scanning methods that people use, they're not good for showing joint instability because when you get an MRI, you're laying down, you're not upright, you're not moving. And to see if a door hinge is loose, you can't just look at the door, you have to move the door. So the joints of the body are the same. So the peripheral joints, we move the joints to see if they have joint instability, and the peripheral joints you can see beautifully under ultrasound, which we'll show a little bit later. And of course, if severe joint instability is not corrected by the surgery, it's not going to be successful. So I guess in summary, I would just say if you've been recommended a surgery and you have Ehlers-Danlos Syndrome, I please would get a second opinion by somebody who's a good prolotherapist. There's three components of pain. There's body, soul, and spirit. The reason why I put this slide up here is I can't emphasize enough that pain is multifactorial. So far you know I've been talking about primarily the structural cause of pain. But you know as well as I do, if somebody has a really good support network, you know, they feel safe, they have a loved one, their parents are supportive, and they just have a structural component of the pain, they do great with prolotherapy. If somebody's in a toxic relationship, you know, they don't have anybody support them, they're alone, they have unbelievable stressors, they can't work, well, obviously those components play a role in the pain. You know, and then I'm a strong believer that God is an ever-present help in time of need. So I can't, and again, trying to do unto others as you'd have them do unto you. If I had Ehlers-Danlos Syndrome and I had a lot of struggles and I was losing hope, honestly, I would open up my Bible. I'd start with the book of Matthew, and you would see that all throughout that book is God loves you, God loves you, God loves you. And to me, that gives me a lot of peacefulness in the midst of all the craziness that's going on. And then some of you might like to hear me. So we have a fellowship that meets every Sunday at 11 o'clock. You can see it on Facebook Live. So if the hashtag is SWF, Saltwater Fellowship, SWF Sanibel. So the teaching from 11 o'clock to about 12:30 is Johnny Cash, relative of Johnny Cash, close friend of mine. And he talks about ways to increase your faith. And then I'm the person that then talks about how to apply it. So if you feel like you need that in your life, and I would say all of us need that, especially at today's time, is to grow in our faith. That might be an avenue that you might really, really enjoy. And obviously, anyone can always email me at drhauser@caringmedical.com. You can email me questions about prolotherapy, joint instability, and you absolutely can email me questions about God, your faith, encouraging things, questions. So always know that when you have joint instability, you get destruction of the joint. So the cause of degenerative arthritis is ligament injury. Once you tear like the medial collateral ligament, the joint forces go medially and they get concentrated on a really, really small part of the joint. So the joint forces go toward the ligament, and that causes cartilage cell death, meniscus cell death. They get torn, and eventually you get complete destruction of the joint. And this is basically what happens. You get a joint, you get a ligament injury. On that side, the joint, the cartilage cells start to die, and then the whole joint gets destroyed. So if you want to stop the degenerative process, so it means that if you have whole body joint instability, you only have a few options. One option is you could brace all the areas, you could limit your activities, which of course a lot of people do because they don't know what else to do, so they lay down all day. But if you get prolotherapy, this process starts to reverse. So in other words, the joint gets stable, then you're able to do more, and then eventually you get back all your activities. See, if you have a knee instability, that means that the femur bone's moving too much and the tibial bone's moving too much, and it's a progressive disorder, meaning that every time you walk, your tibia bone and your femur bone's moving too much, so the hip's going to get unstable and the ankle's going to get unstable. So you actually have to do something about it, and the thing that you have to do about it is to get prolotherapy. These are some of the more common ligament injuries with EDS. For instance, the hip joint, the ligament that gets lax usually is in the front. And then in the neck, it's normally the capsular ligaments at C0, C1, C2. This is just a study. This was Dr. Burling out of New Zealand. He was just comparing two different kinds of proliferants in EDS, and basically both of them worked great. And you could see that very quickly. He was just doing a single joint. So he was studying in Ehlers-Danlos Syndrome, does prolotherapy work to get the joint stable? And between the two proliferants, is there any difference? And there wasn't. And the joints absolutely got stabled in a pretty quick manner. And this is just one of the studies to show that prolotherapy ligaments, the ligament mass goes up, the ligament thickness goes up. You could see it change by 27%. The junctional strength, that means the strength of the ligament, like ligaments are supposed to be like rope. They're supposed to be like rope. And then in Ehlers-Danlos Syndrome, you could think of them like string instead of rope, but prolotherapy causes them to become like rope. So you could run and you can bike and you can do all the things. So why don't we see a little bit of prolotherapy? And the first thing you'll see is motion. You're going to see me move it. So that's me. You could tell it's the minion, so it's me. And then that's how, then now I'm looking at the ultrasound, so you could see the ultrasound, how the knee joint spreads apart. Then we do prolotherapy. Then you do prolotherapy and you do the exact same exam, and then it doesn't move anymore. Right? And you know, prolotherapy, it's like spot welding. So you have to do the whole ligament mesh. If you do the whole ligament mesh, it has more long-standing success, right? That I'm in the business, I want to help people not need me. Like, I don't want them to long-term to come to Caring Medical, because honestly, there's days I don't even want to go to Caring Medical. That was a little joke. Andale. Wow. So here, EDS joint instabilities, so there's various things that you can do in addition to prolotherapy. This is why I did this. So when you have joint instability, definitely get the ligaments tightened with prolotherapy. Then if the joint instability causes your vagus nerve function to go down, you can do vagus nerve stimulating activities like being outside, petting your dog, being kind, making sure your words are a blessing, listening to calming music. Then you'll see that EDS and the pain from EDS causes the hormones to plummet, and I'll show you some data on that. And I think it's very valuable to get an EDS physical therapist. And there's lots of really good EDS physical therapists, and they're invaluable because you need somebody who can help you weave your way through how to move properly and what things to do. And one of them who comes down from South Carolina, comes down with patients, is Susan Chalela. She's awesome. She does teleconferencing, so I'd really recommend her and other physical therapists that do a great job with Ehlers-Danlos Syndrome. So she just did a few slides for me, just explaining that the primary joint stabilizers are ligaments, but also the muscles are really, really important. So Susan is great, and other EDS physical therapists, of teaching people how to do an exercise program that is going to involve the deep and superficial stabilizers. This just talks about the various muscle groups and the various motions that they do. Like, we all know that this is bad and this is good, but how to incorporate that in your life. And it's amazing how much joint instability a person can have, like really severe joint instability, but if their posture is good and their muscle tone is good, how much that can decrease the symptoms. So that's why I think it's really, really important to have a coach, if you will, a coach. And then somebody like Susan does a great job with life coaching and other things. And she knows, you know, everything about Ehlers-Danlos Syndrome. And obviously she's a strong proponent of prolotherapy. One of the slides that she had made for me is the various braces. So I just want to talk a little bit about the various braces, because obviously if somebody has hip instability and it's really bugging them, I'd say get compression shorts, get compression shorts. Or if you're having problems with this and the thing's subluxing, get a posturific brace. And then in regard to the neck, there's all different kinds of neck braces. You just got to figure out the one that works for you. And so this is just other good advice. Like if somebody has hypermobility, EDS, definitely try to cook your own food, eat really, really healthy. Like if you have ligament laxity, a systemic ligament laxity problem, you do have to, here you guys, this obviously may run over 2 hours, so I'm not gonna rush this talk. Because again, this is my last webinar for a while, so I understand that people might leave, and that's fine, but I'm going to just take my time because I got a lot of slides. We haven't even gotten into nausea, fatigue, all the things. So I probably am going to run over, but again, I want to do it the right way. So when somebody has joint instability, obviously the ligaments are lax. So you want to protect the joint, so that involves moving in optimal posture. And for the neck, there's very simple things a person can do. Like if you go on you see some of the webinars I've done before, or go on our site, you'll see that there's a halo weight that a person can wear, which is a weight here, and you just like watch TV, or you just sit in a chair without your back, and then just having the weight here, it's going to strengthen the neck muscles. And it's the neck muscles and the ligaments being strong that actually gives the person the cervical curve. That's just one little thing. And obviously choosing activities like cycling versus running, because running takes a lot more joint instability than cycling. Now, this is another key point. Neurologic injury follows ligament injury. It's not the reverse. So somebody who has a weird neurologic symptom, you know, it could be change in the voice, the eyesight's bad, hearing isn't good, or they have sound sensitivity or light sensitivity, right? And you go see a neurologist and If you have a ligament problem, they're not going to diagnose it because you got to go to a ligament specialist. Like the neurologic injury follows the ligament injury. See, here's C1, which is the atlas. So that's what your skull sits on. And the vagus nerve sits right in front of C1, the ganglion. Then the ganglion of the sympathetic system, cervical sympathetic system, sits right at C2. So think of this. Your whole, or not your whole, but the major part of the autonomic nervous system sits right in front of C1 and C2. See how it says no-dose ganglion? So the no-dose ganglion has the genetic code of your vagus nerves. Like that's the brains. That's what tells the vagus nerve what to do. The vagus nerve is the life nerve. That gives the body life. It is what calms the body down. It stimulates repair. You do a workout and you don't have vagus nerve function, all you do is keep having inflammation, You go to a doctor and they say, oh, my inflammatory markers are high, Yeah, well, what nerve, when you stimulate it, the inflammatory markers go down, the C-reactive protein goes down, your DNA goes down, your rheumatoid factor goes down. It's the vagus nerve. So research the anti-inflammatory cholinergic system. That's through the vagus nerve. That's what gets rid of inflammation in the body. So if you have any doctor's told you your inflammation's out of control, yeah, you have a vagus nerve problem. Why do you have a vagus nerve problem? Because you got instability at C1, C2, and it's banging in the vagus nerve, banging in the vagus nerve. Yeah, the sympathetic chain there, that controls circulation. That's one of the controls of circulation to your brain. So say you get migraine headaches all the time, or you've got brain fog. Well, you probably have instability at C1, C2, screwing up this relationship. The autonomic ganglion are within 2 to 3 millimeters. So remember I said these sit 2 to 3 millimeters from the anterior vertebral bodies. They sit right here before they go into the brain. 2 to 3 millimeters. 2 to 3 millimeters. That's all you need is 2 to 3 millimeters of instability, and you've got dysautonomia. You got a host of things. You got POTS. You got lots of things. Brain functioning is impaired when it's sitting on something that's unstable. So how is your thinking going to be? How is your problem solving going to be if your brain's sitting on something that's unstable? So the most common reason for the vagus nerve not functioning right is upper cervical instability. Get a digital motion x-ray. Then if it's found, then you have to go to experienced prolotherapy. Look at all these symptoms just from rotation of C2. Okay, so the right vagus nerve is here. So say C2 rotates. So it rotates a little bit to the right. So in other words, it rotates. So now the vagus nerve is coming right here, but your C2 vertebrae sits like 2 to 3 millimeters right here. So basically you got this hump here, and the vagus nerve has to go like around it. So bang, 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 right into the genetic code, the cell body of the vagus nerve. So the right vagus nerve goes right to the stomach, right? So you got nausea, your stomach's not working good. Well, you probably got cervical vagopathy, cervical destruction of the cervical curve, which is an instability, which is causing vagus nerve issue to the stomach. So look at all these things: metallic taste, saliva production affected. You have Maldebarkman syndrome, so you always feel like you're on a ship. You always feel you're on a ship. You're dizzy. Or you look at an image and then it follows you. Like you look at another image, but the old image, right? That can all be from ligament laxity, ligament injury in the upper cervical, then causing different subluxations, and then you got your balance is off. Then you have panic attacks. You got earlobe pain. Like all these things can be caused by ligament injury in the upper neck, which of course people with Ehlers-Danlos Syndrome, hypermobility type, are more apt to get. Now I just want to make it clear, every symptom from Ehlers-Danlos Syndrome, especially the vascular type, the classical type, bladder prolapse, rectal prolapse, things like that, prolotherapy doesn't help that. So it isn't like prolotherapy affects everything. Like obviously if somebody has aortic regurgitation, prolotherapy is not going to have that. But if you follow the neurology of all the valvular incompetencies, you will see that it leads to the vagus nerve. So I believe that if your nerve supply to your heart is good, it's much less likely that you're going to have any valvular or heart things. And this is really key. EDS causes stress physiology. So we talked about if you have EDS and you get instability in your neck, then what's going to happen is the vagus nerve isn't working right, so you get blood inflammation, which is manifested by autoimmune diseases and systemic inflammation. You get catabolic physiology, which we'll talk about soon, and then you can get seizures. You can get autonomic storms, which is just like where your heart boom, 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 like I'm going to die, I'm going to die. And that, to me, it means that your sympathetic system is dominant, which I call the death system, because the physiology, when your adrenaline system, your sympathetic system is so active, it makes the physiology in your body toxic. Like it's so damaging because you got massive vasoconstriction, in your body. The blood vessels constrict, circulation gets low, inflammation goes crazy, and that's not a good situation long term. And that almost always is a sign that a person has a lot of neck instability. This is literally what it looks like. So the neurology of the cranial cervical junction is just very complex. The vagus nerve interacts with all the other nerves. And like I said, you got to think of it as controlling. It limits autonomic storms. It limits anxiety. It gives peacefulness. It restores homeostasis. So this is a good illustration. You could see where the vagus nerve, you have one on each side. The left one is the one that's usually dominant going to the heart, and the right one goes to the digestive tract. Right? It goes all the way into the digestive tract. The vagus nerve is almost always involved in any human disease. You're supposed to have a normal cervical curve, right? Here's C1, here's the ganglion of the vagus. When you have, see how this is an actual carrying medical patient. This is a still on their digital motion x-ray. Can I get some more? Then you could see how this is going to be stretched, right? This is a direct route to the brain, where when your curve changes, you get stretching of your vagus nerve, and then you have to take a right-hand turn, and that's right where the damage of the vagus nerve occurs. Now, there are people who get a lot of help by upper cervical chiropractors, orthospinology, atlas orthogonal, NUCA chiropractors. They do amazing work. I get involved with people who they don't hold their subluxation. So if you're going to a chiropractor and you're continually going out of alignment, then of course you have ligament laxity and you need to see a prolotherapist. Here's the nitty-gritty of how you know you have a vagus nerve problem. Remember I said the vagus nerve slows the body down. So if you tend to have high blood pressure for no reason, you probably have a vagus nerve problem. If your heart rate, like my heart rate normally is around 60, if you constantly have a heart rate over 100, your vagus nerve isn't working so good. If your uvula is deviated, if your uvula does not rise, and I'll show you some pictures, and also if you check your pulse and you just slow your breathing down and your heart rate doesn't slow down, then that's another sign that you have a vagus nerve problem. Now, you can measure heart rate variability by getting a finger probe. That's a really good way at home to measure your vagus nerve function. Normally, when you take in a deep breath, your heart rate speeds up a little bit, and then when you breathe out, your heart rate slows down. So, in other words, when your heart rate variability is high, then your vagus nerve function is strong, and when your heart rate variability is low, that means your vagus nerve function is low. Here you could see when you say ah, so any one of you guys can shine a light into your throat, and the palate is supposed to be elevated equally on both sides. In this patient, see how it's not as elevated. So the muscle that innervates, the muscle that elevates the palate is called the levator veli palatini muscle. And in this particular patient, it's somewhat paralyzed on the right side. So I know that that person's right vagus nerve isn't working so good. And then if they had digestive problems, or they had a lot of nausea, or they feel bloated all the time, and they're losing weight, well, that would mean that they have a right vagus nerve problem, so they need to get a digital motion x-ray, and that would show the cervical instability. The uvula, when you say ah, it's supposed to be in the middle. We see they're deviated, they're deviated, they're deviated. And other signs of a vagus nerve problem is urination problems, burning sensations, difficulty breathing, hoarseness, body temperature regulation. You need normal vagus nerve function to just regulate your temperature normally. If you're somebody who, all of a sudden you get hot for no reason, like, you just get hot, you probably have a vagus nerve issue. So obviously chronic pain could give unbelievable fatigue, but in Ehlers-Danlos syndrome, there's so many different causes of fatigue. So this list is pretty right on. Chronic pain, especially the chronic pain of Ehlers-Danlos syndrome, I found that even in like 22-year-olds, you could have a female 22-year-old with hypermobility Ehlers-Danlos syndrome. She looks fine, like she, on the outward appearance, looks fine, but when you actually check their hormones, they have the hormone levels of like a 75-year-old woman. So that means that they have catabolic physiology. They actually, their body has lost some of the ability to repair itself. So you check testosterone levels, DHEA, pregnenolone, which I'll show you. Then, obviously, if you have chronic nausea, you're going to feel terrible. And obviously, if you continuously have brain fog and you can't think and you're not patient because your vagus nerve function is not good, so you're kind of always on alert, it just is exhausting. And then when you have joint instability, just to walk, the energy expenditure is way, way greater. So there's many, many reasons to have fatigue. What a lot of people don't realize is the vagus nerve input is in large measure the nerve input that's required to have your endocrine glands, like your thyroid gland, to make hormone and to release it. So the vagus nerve causes the tissues to release substances. Like in the stomach, when you have vagus nerve input, you release stomach acid. In the liver, you release bile. So if you've been told that you need stomach acid, right? You need stomach acid, or your liver's not functioning right and you're all toxic, well, why is the liver not producing the bile? Why is the stomach not producing stomach acid? It's probably because your vagus nerve, you have vagopathy. You have a blockage of vagus nerve inputs to the stomach. Why would that be? Well, you got your vagus nerve's getting stretched. It has to make a right-hand turn around C1. You have instability, and that's why. So anyone who has a digestive organ like the pancreas not making enzymes, or some of the endocrine glands, thyroid gland, adrenal gland, other glands, parathyroid, is not making the hormones, it's probably because your vagus nerve is not causing the glands to make the hormone. And probably the vagus nerve is getting injured at the nodose ganglion at C1. This is what we commonly see. So this is just a typical patient, an Ehlers-Danlos patient that we see. You could see that, you know, the person's a young girl and they have the hormone levels like almost no levels. So the DHEA, instead of being 130, it's 4. Instead of the pregnenolone being 100, it's 5. Testosterone, instead of being over 50, it's 8. So believe it or not, sometimes we have to give hormones. You know, to have the person have regenerative physiology and not catabolic physiology. So we said with kids, the thing that decreases the quality of life with hypermobility EDS is fatigue and pain. So now we're going to talk about fatigue, and I'm sure you guys with this webinar, you're getting fatigued. But just we got to keep going because all this stuff is important. Cervical instability blocks cerebral spinal fluid. It disrupts blood flow. It causes vagopathy, which does what? You get toxic brain. Like, in other words, if you have cervical instability and the pipes that drain the brain, the veins, if they get blocked, right, you get increased intracranial pressure because the fluid can't get out of the brain. And then obviously chronic pain, systemic inflammation can all decrease basically the nourishment or the fluid in the brain. And once that happens, you can get any kind of personality change. You can get obsessive compulsive disorder. You can get anxiety disorder, personality changes. So if you have hypermobility EDS and your personality has changed, like you know that you're not the same person, and you feel head pressure. Like you definitely feel head pressure. And sometimes when you lay down, the pressure goes away. It's probably that when you lay down, the the pipes, the internal jugular vein are opening, and it's basically flushing your brain. Like, in other words, it's like a toilet being clogged and the toilet flushes. So in the office, we basically do tests to see, are the pipes that drain the brain open, and are the pipes going into the brain, the arteries, are they open? Right? So when you have neck instability, it can cause the pipes, the veins that drain the brain, they can get obstructed. And once they get obstructed, you get increased intracranial pressure, you get swelling of your optic nerves, then the brain just doesn't work. You can get damage to any part of the brain or the brainstem. So if you research on Google and you're like, geez, it sounds like my blood pressure center in my brainstem isn't working, or my nausea center in my brainstem is getting irritated, it's probably that you have increased intracranial pressure. So the way you know that is if you lay down and you can get your head in a certain position, and it's almost immediately you feel better, you're probably right. It's when you lay down, the pipes open and the brain drains, and then the pressure goes down temporarily. So at Caring Medical Florida, what we do is vein studies to see if your vein pipes are open. If they're not open, that's called chronic cerebral spinal venous insufficiency. Chronic cerebral spinal venous insufficiency. And that's a relatively common cause of a lot of the symptoms, the really bad symptoms of Ehlers-Danlos Syndrome. The brain fog, the head pressure, the personality changes, and stuff like that. Okay, and this is an illustration. Normal brain, there's no toxic metabolites in the brain. This is where the person has C1 instability. It's blocking the pipes going out of the brain. So basically, with the internet and the cell phone and all the metabolic activity, all the visual stimuli, it causes all the neuron activity, and all that neuron activity leads to waste products from the neurons. So basically, the neurons poop. If the toilet doesn't flush, the brain doesn't flush, all those toxic metabolites accumulate, and the person feels like, I've had many Ehlers-Danlos Syndrome patients tell me it's almost like they're getting Alzheimer's at the age of 22. And you guys know what I'm talking about. Terrible brain fog, terrible memory. They can't problem solve. Some of them have to drop out of school. I've had numerous ones have to drop out of school, so I have to treat them and get them back to school. And this is just studies that show that if you have joint hypermobility syndrome or Ehlers-Danlos syndrome, you are like 10 times more likely to have an anxiety disorder, 7 times more likely to have panic disorder, just incredible amounts of anxiety in that. And I'm just saying that the anxiety, it's a structural anxiety. It's a structural obsessive compulsive disorder. It's a structural depression. It's structural. In other words, the brain's not draining. The brain's toxic. The vagus nerve isn't working. Beside all the other stuff, the person can't go to school, can't work, this or that. So once the structure gets fixed, like the brain is now sitting on something that's stable, there's no obstruction of blood flow into the brain, there's no obstruction of venous drainage out of the brain, guess what? The brain function starts coming back. Yeah, again, like you could just see all the different odds. It's much, much more likely if somebody has Ehlers-Danlos syndrome to have all kinds of issues. Neuropathic pain, 4 times as likely. Abdominal pain, 6 times as likely. And basically, it's all because of toxicity. Toxic autonomic nervous system, toxic peripheral nervous system, toxic brain. And this is, we see that it obstructs the vertebral veins, the internal jugular veins, and you get chronic cerebral spinal venous insufficiency. You can have decreased blood supply to the brain, right? You get hypoxia of the brain. So very good illustration, kind of a summary of some of the things that I've talked about so far, right? So once the neck gets stable, once the neck gets stable and the neurology, the autonomic nervous system gets back to normal, a lot of the toxic things start to go away. Now, when you have neck instability, I just wanted to bring this up. When you have neck instability, like say you have neck instability on the right side, it's going to stretch the vertebral artery, stretch the vertebral artery, stretch the vertebral artery. Well, eventually you get dolichoectasia of the vertebral artery. Dolichoectasia of the vertebral artery, when we check for this in the office, it means the vertebral artery goes crazy. It just starts going in all different kinds of locations. And in this particular patient, it was actually, see how the vertebral artery on this side, how big it is and how little it is on there? Well, it's actually compressing the brainstem. And it could compress the brainstem, for instance, where the nuclei are for tongue motion. So then all of a sudden, the person, they have symptoms related to the tongue. Or you could have a metallic taste in the mouth, or you can't swallow, right? So this is, and Izzy took this one, this is C1, C2. That's normal anatomy of the vertebral artery. Look at this patient. That's called dolichoectasia. So that's why in the office sometimes I'll do C1, C2 shots with ultrasound guidance instead of X-ray guidance just to see where the vertebral artery is, because normally, see the C1, C2, that's where you would do prolotherapy. So if you didn't have ultrasound guidance, right, you wouldn't see that vertebral artery, and then of course you might hit it. Okay, let's watch Karina here. We're going to watch her case. Very, very interesting.
I had episodes where I would just start convulsing. It looked like a seizure, but it wasn't. I would go unconscious sometimes, so it's a dystonic storm. And those could last for hours sometimes. And then when I turned my head a certain way, or I couldn't even lie flat, it would trigger me. I would lose my vision.
Watch this right here. The blood supply. See how the blood supply stops? The blood supply is stopping with that motion. See, then she started having a dystonic storm. See how it stopped?
I couldn't even walk down the hallway in my house without a walker. And some days I couldn't walk at all. So, yeah, and now I can walk without a mobility aid. I couldn't go without my neck brace either. I couldn't even breathe or see without it. And the other day I left the house and forgot it. So then I don't even really feel like I need it anymore. It's incredible. And we also worked on my lower back, and I've always had issues with that. And as soon as we did it, I was still a little bit sore, but I felt like I had a brace on. I think that's how supportive it felt.
Awesome.
I could walk again and stand up straight. And I feel taller.
Well, you actually are taller. Yeah. And we're not here to pretend like that you're done in the sense, like we did do a digital motion x-ray, and even, you would even say like, geez, it's like so much better. Like it absolutely tightened up the ligaments. But of course the neurologic recovery, like you got to gain some weight and for somebody who is, who's in a really bad state, who's like they feel pretty hopeless. What would you say about, the whole process of prolotherapy? And
I'd say that even if you have a chronic condition like Ehlers-Danlos Syndrome, you can recover. I was the most severe case probably, and if I could do it, then you definitely can. We did a really aggressive approach, and I'm not gonna lie, it was painful. And some days you feel like you're not improving, but you are. You're gonna feel worse before you feel better, but it's productive pain. That's what I call it.
Okay, that's good.
Because you're working towards getting better.
And then, has your breathing been good? Okay.
Yeah. After we did the hyoid injection, I haven't had any issues with that since.
And then you had said like there was times for hours you might have these dystonic storms, And obviously some of those times maybe you went unconscious, and probably even during some of them you might have had breathing issues too. So how has that been?
I haven't had any Dystonic Storms, even when no one actually believed it in my family. They kept telling me to do things that used to trigger me, like lay flat and stand up now. Okay, turn your head, and they were amazed that I don't convulse at all anymore. No Dystonic Storms.
Awesome. Now, one of the most common things that we get questions about is ringing in the ear. So I just want to have you talk about, when would you get ringing in the ears, and then did prolotherapy help the ringing?
Yeah, it definitely helped. I would get head pressure, and that would cause the ringing in the ears. I also got this feeling that you can hear the fluid in your ears, and I would have spinal fluid leaks from my nose and ears.
Did those stop too?
Stopped. Yeah, they actually stopped.
Okay. Wow, that's gotta make you happy, huh?
Yeah, I can't believe it. It's still kind of in shock.
Yeah. Hey, like everything always has a cause, and the office, we get emails from all over the world, and different things, like for instance cerebral spinal fluid leaks. So if you have any kind of weird symptoms and you got like clear fluid coming out of your ears or your nose, you probably have a cerebral spinal fluid leak. But again, what would cause that? And the cause of that is cervical instability. So the treatment is to resolve the cervical instability. And in Karina's case, that related to prolotherapy. We are going to put her whole interview, on the internet. So that was obviously cuts of it. One of the most common things that we get asked is, what about postural orthostatic tachycardia syndrome, and what can we do about that? So POTS is synonymous with dysautonomia, meaning that when you say somebody has lightheadedness when they go from standing to sitting, it means that your autonomic nervous system is not regulating blood pressure. This almost always has to do with too little vagus nerve activity. So too little vagus nerve activity, and in EDS the cause is almost always upper cervical instability, and in my opinion the most curative treatment for postural orthostatic tachycardia syndrome is prolotherapy. And like I said, we see really dramatic cases of it. Like probably right now, I have 4 patients that have central lines. Like they have central lines. One of them, I had it put in. It was a new patient, and I actually had it put in just because of the severity of the blood pressure problems. And some people, to keep their blood pressure up so they're not lightheaded all day, or their pulse rate, it goes out of control, they actually give themselves IVs, salt IVs, which of course increases the blood pressure. This is the criterion for POTS, and just know the cause of POTS in almost everybody with Ehlers-Danlos Syndrome, hypermobility type, it's from cervical instability, screwing up the autonomic nervous system. Remember, the autonomic nervous system, the hub of it is right there, is at the cranial cervical junction, like I said, at C1, C2. Now, what's supposed to happen is when you have low blood pressure, what ultimately is supposed to happen is vasoconstriction or sympathetic activity, which causes the blood vessels in the periphery to constrict. And this system is dependent on the body knowing what the blood pressure is. So there's 2 main blood pressure sensors in the body. The one is at the carotid artery, so that would be about right here. There's a sensor which the nerve supply of that sensor is the glossopharyngeal nerve. That tells the brain what is the blood pressure in the artery, the carotid artery going to the brain. So that's the first thing. The second thing is at the aorta. So at the aorta, the sensor, the nerve sensor in the aorta, to tell the brain what's the blood pressure going to the rest of the body. That's the vagus nerve. and the glossopharyngeal nerve is cranial nerve 9, the vagus nerve is cranial nerve 10. They both run in the carotid sheath of where the carotid artery is in the internal jugular vein. So let's think about this. The internal jugular vein is the main pipe that drains the brain. Then the two main sensors for blood pressure in the body are in the same sheath right in front of the C1, the C2, the C3 vertebrae. They're right in there. So you could see where if you have cervical destructure, right? So instead of the vertebrae looking like this, because of ligament laxity, it's like this. That's going to stretch that carotid sheath. Then you have instability, so it's banging on the internal jugular vein, the glossopharyngeal nerve, the vagus nerve. Then the blood pressure system, the sensors of the blood pressure system, they're down. So when the signals are all screwed up, the blood pressure system of the body is going to get all screwed up. So in other words, the blood pressure sensor to the body at the aorta, the vagus nerve, that's not working. Then the sensor, the glossopharyngeal nerve going up to the brain in the carotid artery, that's not working. And what's supposed to happen is when blood pressure's up, the vagus nerve is supposed to fire to slow the heart rate down and cause vasodilation all over the body. And likewise, when the blood pressure is down, the sympathetic system is supposed to fire to raise blood pressure to vasoconstrict throughout the body. But when these sensors don't work and the vagus nerve can't actually give the right input into what the blood pressure would be, then of course what happens is when you stand up and your heart and your blood pressure should go up, it doesn't go up, then the heart rate goes up like crazily to try to raise the blood pressure, but the vagus nerve is supposed to kick in and lower the pulse rate, but it doesn't. So the person, when they get up, they feel dizzy, and then boom, 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 and they get tachycardia. And the worse the vagus nerve function, the worse that reaction is. That's like a key point. So if like a person has to be extra careful getting up, otherwise the pulse rate's going to go crazy, then you know you have really bad vagal nerve function. Or like I have a patient right now who literally, they're in their 20s. I kid you not, they're in their 20s and they already have a pacemaker. This is how bad this is. They have a pacemaker, they're in their 20s. So in other words, when the vagus function can get so bad that you can start getting heart arrhythmia. So if you're a young person and you're starting to see a cardiologist, I'm telling you, you basically should see me and then have my team evaluate you and see how your vagus nerve function is, whether you got severe cervical instability. So that's another key point. Then when you have POTS, these are all the symptoms you get. You can faint, you get lightheaded, weakness, palpitations, you feel jittery, shortness of breath, and obviously what happens is the blood pressure tanks, the brain circulation tanks, and the heart rate skyrockets. So that's basically in a nutshell. And the way to resolve it is you got to get the blood pressure control to be normal, and the only way you can do that is vagus function has to be normal and the glossopharyngeal function has to be normal. Now the glossopharyngeal also innervates part of the tongue. So if you notice that you have a metallic taste or something like that, or the food doesn't taste like what it normally does, then that would be another sign that you have a glossopharyngeal issue. So how upper cervical instability causes POTS? The person stands and the blood pressure drops. The heart rate increases to try to raise blood pressure. The vagus nerve impulses block because of cervical destruction and instability. So there ends up being uninhibited sympathetic nerve discharge in the neck. So that causes the heart rate to stay elevated, and that also causes vasoconstriction of the blood vessels to the brain. So obviously if you're not getting a lot of blood supply to the brain, then you can get dizzy, you get weakness, you get tachycardia. So that's kind of the pathophysiology of it. And the treatment should be basically stabilization of C1, C2. So you have the aortic arch, the vagus nerve input to it, and then the vagus nerves run right by C1, C2. So once you stabilize C1, C2, then eventually the POT symptoms decrease, 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 and eventually they're gone. So I just wanted to show really briefly, this is just a 3D animation, just kind of shows what prolotherapy to those C1, C2, just a very short, you could see the prolotherapy goes in there. This area, obviously we do it under guidance, then the C1, C2 stabilizes, then you don't have the stretching of the vertebral artery, and headaches, dizziness, other symptoms related to C1, C2 get better. A very common thing that our patients with Ehlers-Danlos Syndrome suffer with is nausea. Now, I think most of the nausea is caused by gastroparesis. So that's easy to document because the person would say, honestly, doc, I just can't eat a lot of food. So recently, this was like 2 days ago, we had a new patient, 15-year-old, who now isn't growing and has lost a lot of weight because the stomach's not working. Now it's interesting, once we put the person in the right cervical collar, we determine what position should the neck be in to optimize vagus nerve function, start prolotherapy. I've had vagus nerve function return basically right away. One time I had a client who they had lost so much weight that, they were planning to like come and go. Like some of the patients obviously live in Southwest Florida for a couple months, several months, depending on how severe it is, because sometimes you just can't travel back and forth. It's actually too dangerous. So I had a patient who was planning to fly back. They were a new patient. And I said to them, I can't let you go unless your stomach function comes back. Like the young lady had lost so much weight where it was getting to the point where almost she needed a central line. So I treated her on Thursday. Then I said, I think she was planning to fly home like on Tuesday. I said, you got to see me on Monday. And then honestly, the whole weekend she ate like normally. So sometimes it's as quick as that, where the NTS is one of the vagus nerve nerve tracts in the brain stem. So basically the sensor of the stomach and the liver and the intestines is the vagus nerve. So if the vagus nerve inputs are not normal, what's going to happen is intestinal function isn't normal. And if intestinal function isn't normal, food just sits there. And you guys know what it's like to have food just sit there. What happens? You feel bloated and eventually you get nauseated, and what happens? You vomit. So you vomit. So if you have a young child or you're a person with Ehlers-Danlos Syndrome and you continually are vomiting, I'm just telling you, almost always it's a vagus nerve issue. And here's the many causes of nausea in hypermobility Ehlers-Danlos Syndrome. When you have obstruction of cerebral spinal fluid flow and there's increased intracranial pressure, it can cause nausea. So just that can cause nausea. If you get inhibition of the vagus nerve because of stretch, compression injury, you have poor pancreas, liver, stomach, that obviously can cause a lot of food sensitivities, and then you just have a lot of nausea. Then obviously also if the cervical instability screws up the eustachian tube function, so it's like you're on a boat and you feel seasick, right? You can feel seasick. So the person who feels seasick all the time, that again is normally cervical instability screwing up the eustachian tube function. And then also you can get a hypersensitive smell. So if you have a hypersensitive smell, again, remember the vagus nerve inhibits. So the olfactory nerve, which is cranial nerve 1, if it's hypersensitive, like all of a sudden you have a change. This is another sign that you have cervical instability. If something changes, like you had a normal sense of smell, now it's a hypersensitive smell. You have, all of a sudden you have light sensitivity. You have sound sensitivity, like any little sound, even your own voice. That's a sign that you have vagus nerve issue. You have upper cervical instability. So you could see all these things So a hypermobility EDS, when you get upper cervical instability, it's a setup for terrible nausea. And then, of course, the treatment's going to be stabilization of the neck. Once you get stabilization of the neck, motility of the digestive tract returns, and then enterocolitis goes away, esophageal dysmotility, gastroparesis, gastroesophageal reflux goes away, inflammatory bowel disease, obstructions go away, pyloric stenosis. I have a patient right now that is one of the main reasons they're seeing me is because of, believe it or not, pyloric stenosis. Like, there's a cause of pyloric stenosis. It's the valve between your stomach and your duodenum. So all the valves, think about it, there has to be good coordination when you eat food that the esophageal sphincter closes, right? Like, what causes it to close? Well, it's the vagus nerve. So if all of a sudden you're always refluxing, or the valve between your stomach and your intestines doesn't open or close normally, again, follow the neurology. And neurologic problems follow ligament injuries. So you follow the neurology, then you see where is that nerve. That nerve's in the neck. You got neck instability. If the nerve is in the thoracic, you probably got thoracic instability. Chronic constipation, chronic burping, chronic stomach pain, chronic painful bowel movements. These are all signs that you have GI dysmotility from vagus nerve problems, vagus nerve injuries. You have cervical vagopathy. You need to get a digital motion x-ray, get prolotherapy to stabilize your cervical spine. Once the cervical spine stability returns, then food, it gets digested. There's no more nausea, no more vomiting. So we've talked about this. So these are all lifestyle, obviously, recommendations that we give to people with hypermobility, Ehlers-Danlos Syndrome. In a nutshell, what I would say to leave here, and we're almost done, is that when a person's nervous system starts to tank, like they always feel like their sympathetic system is on hyper alert, like they're going to die and they're getting hopeless. At Caring Medical, our responsibility is to make sure that we know what the neurology is. We do the right tests. If there is vascular compromise in the neck, like, let's document it. Then let's see if there is instability. If there is instability, figure out a treatment plan with prolotherapy. However, the person in the rest of their life, they have to practice health. Because if you practice health, health is going to return to your body. And what that is, okay, physical body health. So I'm going to eat healthy. I'm going to, exercise as much as I can. Then in the soul is the emotions. So I am going to be a blessing with my words, even if I don't feel good. Even if my father or mother or somebody treats me bad, I'm going to treat them with kindness, because that's basically one of the things that Jesus taught. Then I'm going to watch things that are uplifting. I'm not going to watch negative news. I'm going to be around people who are positive. I'm going to listen to music that's uplifting. I'm going to listen to symphony music, pachelbel, love music, not like angry music or complaining music. Then with my faith, and faith or the spirit has to do with the human conscience, right from wrong. Like, I'm going to live my life in a truthful, loving manner. And if you just do that, and again, the office here, we help people with it as much as we can, as much as they want to get us involved with it. It's amazing how health starts returning to your body. And Karina, she wrote a note on her last day there. It's here somewhere, but I know the main thing I was going to read was that she said, beside giving my life back, you gave me faith back. And faith, let's be honest, like faith that God loves us, God's there for us, and that God has a plan for our lives, and the plan is awesome. And once a person gets the gift of healing, so in other words, they were really disabled, then They got the gift of healing. It's amazing what happens in their life. And they start giving that gift of healing to others. And that's a major way to get the world a better place. I don't have to go over this. This is in some of our other webinars, so I would definitely recommend anybody who wants to delve further into the vagus nerve or the toxic brain, please see our other webinars. Obviously, prolotherapy can do all the joints. We do have people that, I've had people come even for 3 days in a row and basically do every joint of their body. And prolotherapy obviously stimulates healing. Corticosteroids and other things, they actually inhibit healing. They actually make ligaments weaker. And you guys know stuff like Levaquin and some of the antibiotics and the medicines, they definitely can make ligaments weaker. When your hormones go low, it makes the ligaments more prone to getting injured. So regenerative medicine, prolotherapy, natural hormone replacement, proper diet, proper exercise, proper bracing when needed, it all has to do with getting the body stronger, healthier. Think about, like, in other words, the prognosis without prolotherapy, let's be honest, it's not so good. You know, it's not so good. So you wonder, my passion would be to get prolotherapy, you know, accepted around the globe as a common treatment in the discussion for hypermobility and other forms of Ehlers-Danlos Syndrome, as well as any other systemic or localized joint instability syndrome. Right? If prolotherapy was utilized around the globe, how much lower would these numbers go? Right? Ehlers-Danlos Syndrome, 95% have joint pain. You know, 93% have hemorrhages. 75% have dystonia. You know, how much lower would these numbers go? Right? If you do prolotherapy for EDS-induced joint instabilities, right? You get at the root cause of endocrinopathy with EDS. You get at the root cause of dysautonomia. You get at the root cause of muscle weakness. You get at the root cause of the poor energy. You get at the root cause of the immune system dysregulation. You get at the root cause of the leaky gut. You get at the root cause of the headache physiology. You get at the root cause of the brainopathy. Now, all these other things are helpful, right? Peaceful heart, expressive joy, soothing sounds, natural hormone replacement, low impact exercise. All these things are good, but they're on the periphery. What you need to do is get at the bullseye. The bullseye for resolving the major symptom, the disabling symptoms of Ehlers-Danlos Syndrome, is you have got to resolve the systemic joint instability. And the way to do that is prolotherapy. So now we're going to hear from Rebecca, who I started treating at the age of 13.
Is there anything you do or that inspires you, or how do you cope with it?
Yeah, there is. So I always look for joy. And so even in the worst moments, there's always something to be grateful for. There's always something that's joyful, you know, whether it's just looking outside and it's beautiful outside, or listening to a beautiful song, or thinking of the wonderful people in my life that are there for me. There's always joy.
You know, and Rebecca, age 13, started to see me. She's now I think she just turned 24. She just turned 24. She's now going to be a prolotherapist, so she's basically in training to be a prolotherapist. And then she's the reason why we do what we do. And our hope at Caring Medical, basically our hope at Caring Medical is that in the future we can see so many more Rebeccas. Like Rebecca, was almost in a wheelchair. Now she's going to be a physician assistant and hopefully be one of the bright lights in the future for treating people with Ehlers-Danlos Syndrome with prolotherapy. Thank you. I know it was long. I hope that you were benefited from it. I just want you to know that at Caring Medical, hope is practiced here, and we love you. We want to help us. Let us know how we can help you. Thank you for listening.